As always, thank you to everyone for joining us. We have several things that have flown in last minute on the agenda, as lots of things are going on right now. I know you're aware of that. So I am not going to take any more time, and I am going to turn this right over to Val.
Okay, thank you, Heike. Good morning, everybody. I see our number of participants is quickly climbing, which is great. I got to close some stuff on my screen here. Thank you all for joining us. I know we do have a lot of information to go through today, and I'm not going to lie. Everything we tell you today, we will probably be telling you over the course of the next month. So you're going to hear this more than one time, and we're going to be learning about this stuff more than one time. The first thing I'm going to have Heike pull up is yesterday, Governor Parson issued a state of Missouri public health warning. And this public health warning talks specifically about what we are expecting out of residents of the state of Missouri in terms of their personal behavior. And that personal behavior advisory says things like wear a mask at all time in public or other settings outside of your home where social distancing is not possible. Always try to maintain a limit of 6 feet wherever possible and limit close contact with other individuals to less than 15 minutes. Of course, wash your hands. The biggest one, and the one that I know we're still struggling with in our state facilities, I'm sure most of our provider agencies are struggling with, stay home when you are sick or if you have symptoms. COVID symptoms are a cold, they're allergies, they're burning eyes, burning nose, they're a sore throat, they're a headache. They mimic a lot of other symptoms. I know that we've got a workforce that is exhausted and we need every employee to come to work that can, but we've also got to screen out those that are not healthy because that is how it spreads. That's why we push the testing so much. Get them tested, you'll know quickly if they can come back to work or not. So I wanted to make sure that we talked through that. Limit your regular interactions to a small group, less than 10 family members, friends, or coworkers if you live in a Category 1 or a Category 2 community. And we're going to go over what those Category 1, Category 2 communities are in a minute. There's a business advisory here also. In addition to the basic guidelines for individuals, businesses need to implement basic infection control prevention measures. We do that, modify physical workspaces, develop infection disease preparedness and response plans, monitor, that should include doing your own contact tracing. And so I want to make sure this is clear for everybody on the call. In most counties in the state right now, you as a citizen and you as an individual will be responsible for doing your own contact tracing if you test positive. So try to keep track of where you've been over the last 48 hours so that you know who has been close to you if you do test COVID positive. So I want to make sure that people understand that. And the same for workplace. That is going to be workplace. I mean, we need workplaces to take responsibility for this at this point. Travel advisory, they want to minimize the risk of COVID spread within Missouri and across the state, especially as we approach the holiday season. We're going to go through some things that kind of help you guys think through that in a little bit, but please minimize travel outside of Missouri. If you are going outside of Missouri, please take into account individuals that are high risk. Encourage people to self-isolate as much in advance of any gathering as possible. And do not attend any gatherings, family or otherwise, if you have any symptoms. I know somebody asked me the other day, is diarrhea a symptom? Yes, it's a symptom. Nausea is a symptom. Losing smell or taste are symptoms. That's the big bells are ringing. Not everybody has it, but it's a symptom. So there's also a local government advisory included in this. This really talks about how Missouri is a local control state, and as a local controlled state, it's important that local government makes decisions that are unique to each community. Those decisions can be more stringent than the baseline public health. While the state of Missouri provides a baseline of public health standards and expectations, local communities can establish higher, more stringent standards above the state's public health advisory baseline. And I know we're seeing that across the state right now. Then I would like to go on, Heike, to the next. Oh, you've got it up already. There's a note at the top of this. Oh, no, go back real quick, and then we'll move on to that one, Heike. I'm sorry. There's a note at the top of this page. Oh, go back. At the top of the third page, scroll down a little bit further. Oh, no, go back. Why is it doing that? I'm sorry. I'm going to have her go back one more time. Because the third page of that public health advisory talks specifically, I think she's trying to scroll down and it's doing that to her, talks specifically about what are the categories and then what are the advisories for those categories. So category 1, a county is in category 1 and considered extreme risk if they've had a PCR 7-day positivity rate, and I'm going to show you where to get this information in a minute, of 15% or above using the CDC method. So the state of Missouri had previously been showing 2 positivity rates. One was the CDC method and one was the state of Missouri method. We have now moved away from the state of Missouri method and are only using the CDC method. So that is there to avoid confusion, although sometimes I think it causes confusion. So what I want you to know is the one that you're seeing on the public-facing dashboard is the one you need to be paying attention to. Also, the 7-day case rate per 100,000, if that's above 350, then you are a county that's considered an extreme risk. The advisory recommends business occupancy limits reflective of social distancing. That includes social group sizes of 10 or less. Note for the purpose of this advisory, in big, bold letters, social group is defined as any planned or spontaneous event or convening that would bring together a group of people in a single space at the same time. This excludes normal business activities, religious services, schools and school activities, and extended family gatherings. So I think this probably applies mostly to places like restaurants, gyms, but it also gives businesses something to point to whenever they need to make decisions that really best reflect them. So what masks are also strongly advised in all offices and businesses where social distancing is not possible. At the top, before we go through what all these categories are, it says that communities can move down in a risk category after 2 consecutive weeks of meeting the lower categories criteria. So you stay in extreme risk if you're in extreme risk until you have 2 consecutive weeks of a positivity rate below 15% and a 7-day case rate below 100,000. I'm not going to go through what category 2 is or category 3 is because a lot of folks in this state are already in the extreme risk category, category 1. So now I'm going to have Kaika pull up the website where you can go and see where your county is. And we're going to use Cole County because we know Cole County is in the extreme risk category. So this is on the state public-facing dashboard, and we've shown this to you many, many, many times. So the information in the top is on the left side where it says cases to date 5,426, deaths to date 38, tests to date 54,085. That is data since the beginning of the pandemic, so since March. When we talk about what we talk about in category 1, those risk levels, that's going to be on the right side of your screen. We're looking at the past 7 days. So cases in the past 7 days for Cole County are 556. That is the 7-day case rate per 100,000. We may have to go down to see the 7-day case rate per 100,000. So let's scroll down a little bit, Heike, to the bottom, and you can see these red boxes is where we need to be looking. So new cases are 556 for the past 7 days in Cole County. That equates to 724 per 100,000. Remember, to get into extreme risk category, you only need to be at 350 or above for cases per 100,000. So in Cole County is substantially above that 350 cases per 100,000 level. Thank you, Kim, for putting that in the chat. The 7-day positivity rate, CDC method, is supposed to be anything 15% or above puts you in this extreme risk category. Cole County is at 27.6%. Those 2 boxes are the 2 boxes that you need to look at whenever you're determining if your county is an extreme risk county, a critical risk county, or a serious risk county. And just so you know, critical risk, really everything stays in place except social group size goes up to 25 or more. Not much changes between what is expected in terms of what advice is supplied to businesses and counties to do their work. So that, I wanted to go through that with you all. I wanted to make sure you had access to it. I wanted to make sure you knew where the tools were and how to use those tools and apply them to your work. I don't think I need to tell anybody on this call, because you guys have been actively participating in these calls since March, how dire the situation for the state of Missouri is at this point, and how important it is that everybody follow just the basics. And we talk about the basics all the time, but I think the hardest basic for people to follow right now is staying home if you are sick and taking that sickness seriously and finding out whether or not you have COVID or not. A COVID negative test gives you lots of relief, and then you don't have to contact trace for the last 48 hours, but it is our personal responsibility to be doing that at this point in time. So take a look at it. All of this information, you guys know, is public. Share it far and wide. Share it with your work folks, share it with your social folks, share it with your church folks, your school folks, anybody you can get to listen and look that needs this information and needs to go through it. The other thing I want to show right now, Heike, is that risk website. So I know as we approach the Thanksgiving season, it is really hard to say I'm not going to dinner at Grandma's. But they have a planning tool out there, and we're going to scroll into Missouri. Actually, first, Heike, in that left side where it says event box, right now that's showing 50 or more people. Let's go ahead and make that 25, because I think 25 is a pretty decent, I mean, if you're having a family dinner on Thanksgiving, 25 is a pretty decent size if you've grown up with families like mine. So 25 is the minimum. That's a small group. And if you'll go ahead and make it larger to get, oh, you've got it up there already. I just can't see. So for Cooper County, Missouri, if you have an event of 25 or more people, there is, I believe that says an 81% chance that someone in your group is going to have COVID. And so when you pass the turkey, 81% of the time you'll be passing the COVID around the table. And so that's kind of when she goes to Cole County, and I mean, I'm on the small, I wanted to be on the camera today to see you guys, but that means my screen is teeny, teeny, tiny. So for Osage County with 25 people at the table, the risk level is 77%. There's 77% chance that somebody at the table is going to have COVID. This also is a tool that you guys can share. I know what our facilities are doing at the state level. We're pushing this out to, we call everybody that works in our facilities right now healthcare heroes, because I cannot imagine doing the level of work and for the time that we've been doing it, and it's not getting better, it's getting worse and harder right now. But so we kind of, and I sent this out to our providers, and so you guys have probably seen this message, but it's a plug and play message where you can just pick your county. You can use this data to say, please think twice before you make your plans. And another thing that was included in that message is just what those executive teams at that location were going to be doing for Thanksgiving. And they're staying home, because that's what we need to be doing at Thanksgiving. We need to limit exposure as much as we possibly can, and it's not going to be easy. But I am happy to hear pretty regularly that is the decision folks are making. So I'm proud of folks for making that decision. Testing update is what we'll go to next. So we did get really good news this week. I know a couple weeks ago I had announced that we would no longer be able to pay for testing after November 15th. But that has been changed. So for anybody that's got some patient-facing healthcare workers, so our residential providers, our day hab providers, if you've got an outbreak with residents or individuals in supports or staff, personal care too, let us know, and we'll work on getting testing covered for you. I know we've done that for a lot of folks. I know a lot of folks had testing occurring in a regular rhythm. We had a disruption for about a week there. This has now been extended till December 30th. That's when the CARES Act funding deadline currently is. We do expect Congress to make some sort of federal funding, either CARES Act extension or other federal funding decisions for COVID in December. However, they haven't to date, and so this is what we know, and that's the information we have to share. But also, any providers that have been doing testing, I greatly appreciate that. And you guys know this, I firmly believe testing is what keeps this out of our locations, no matter their size, and keeps the individuals that we support safe. The next thing we want to talk about is the vaccine update. Oh, no, one computer went down. Okay, I got it back up. The vaccine update. So there is, let's go to that vaccine.mo.gov site first, Heike. covidvaccine.mo.gov. You have that one? Okay, hold on.
I will.
We'll talk through this. Okay, we'll talk through this one. No problem. We'll talk through this one first. Unfortunately, our office got closed today, and we always find out at like 4 o'clock that that's going to happen. So we're doing our best, working apart, and we want to work apart because we know that's where we need to be right now. This right here is really about vaccinator enrollment, and so I want to talk about vaccinator enrollment and when we expect to get vaccines for individuals we support. So I'm going to mute you, Heike. Maybe I'm not. So specifically for the way the state's plan for vaccination works right now is there's Category 1A. And Category 1A are employees, patient-facing healthcare workers. And that is us. That is us, our community providers, our patient-facing healthcare workers. I don't think our targeted case management entities would not qualify as patient-facing healthcare workers, because if it's a job that can be done telehealth-wise, it doesn't count. So, nurses that are doing telehealth would not count as patient-facing healthcare workers. But all of our residential providers, no matter the size, qualify as a 1A provider in Missouri. I think our day habs qualify as a 1A provider in Missouri. So all of those providers should be figuring out how to get vaccinations for their staff at this point in time. And I will tell you that there are we estimate about 500,000. We think that's a low estimate of patient-facing healthcare workers in Missouri. That's hospitals, that's nursing homes, that's our folks, that's the folks in the psych hospitals that are working. Our first round of doses of COVID vaccine is going to be around 167,000. And so we know that we are not going to be able to get even all of those patient-facing healthcare workers the vaccine in that first round. So not only are we focusing on patient-facing healthcare workers, we're also focusing on those patient-facing healthcare workers with comorbidities. So we want to try to get those folks vaccinated first. So if you've got diabetes and you're a patient-facing healthcare worker, you are the priority for this first round of vaccines, and that includes everybody that works for us. And I've gotten all of that confirmed just in the last 24 hours. So we're going to be working on sending out some information so that you guys can help plan for that. There are a couple of ways that you can, and what I'm suggesting and what I think we're going to be doing on the state side, we're going to approach this from 2 different ways. One, if you want to be a vaccinator yourself, you need to go to the COVID-19 vaccinator enrollment site. You will have to have a medical director to do this. So if you don't have a medical director, this will not work. I'm not even certain the state is going to be doing this COVID-19 vaccinator enrollment, and I'll tell you why. But we're going to sign up anyway, because signing up doesn't put you on the hook to do it. It just makes it an avenue for you to access vaccine when vaccine is available in case you can figure something out. There are 2 vaccines out there that are most likely to come to Missouri. One is the Pfizer vaccine and one is the Moderna vaccine. The Pfizer vaccine requires cold storage less than -70 degrees. If you don't have that, you've got to have dry ice. Storage of the vaccine is the issue. So the Moderna vaccine can be stored in a refrigerator. So you want to sign up in this COVID-19 vaccinator enrollment category if you can, because if we get access in the state to the Moderna vaccine, which we don't know yet, and I know that's frustrating, but if we get access to the Moderna vaccine, the storage is no longer an issue for you, and you could easily become a vaccinator at your site. For some of us, not for all of us, but for some of us. So I wanted to make sure that you understand why it was important to enroll in this category. I'm sorry if you're hearing an echo. I'm trying to use my earbuds because that usually works better. The next one I wanted to talk about that you can enroll with is call your local pharmacies and your local because I know most of especially our residential providers, work directly with a pharmacy. Talk to them about becoming enrolled in the vaccination program, and they would enroll through that COVID-19 vaccinator enrollment that we've got up on the screen right now. And then whenever it comes time to get the vaccine, you would say, pharmacy, I need 50 doses for my staff. Because remember, we're only doing patient-facing healthcare workers in this first round. They would put in the order, and then they'll call you back and let you know if they get 20, 10, 5, whatever. So I wanted to make sure people understood that. There's a third option too, and in some of the counties, this is going to be your best option probably, and that's to work with your local public health agency. So the local public health agencies are all supposed to be enrolled as COVID-19 vaccinators. Now, I recognize that some of you live in counties in the state of Missouri where you've got like 3 people that work at your local public health agency, and you may not feel like that's the way for you to go. However, I want you to know, still contact them, still work with them, because there will be some rapid vaccination teams that go out, and those to help those local public health agencies with the actual vaccination. So they're called regional implementation teams. So don't let the fact that you have a small local public health agency be the reason you don't work with them. The next thing you're going to need to do, though, is you're going to need to understand how many of your employees are actually interested in getting the vaccination. So because this is an emergency use authorization vaccination, nobody can mandate. We cannot mandate for residents. We cannot mandate this vaccination for employees. That's not an option for an emergency use authorization vaccination. So you need to be surveying your employees to find out who is actually interested, because you don't want to tell your local public health agency or your pharmacy that you need 50 and then only 5 of your folks are actually interested in getting the vaccine. So I wanted to share that information with you also. So I told you 1A is where the first groups of vaccination go to. Those are patient-facing healthcare workers. So you need to be thinking about this and how do I get my employees vaccinated in the first round? Then you still need to be thinking about how you get the individuals you support vaccinated in the second round, because anybody who lives in a long-term care facility, and we fall into that category, they are going to be eligible in the 1B. So when we get enough vaccines into the state and we feel like that 1A category is satisfied, they will move to the 1B category. And again, you can do the vaccinator enrollment, talk to your local public health agencies, but you are going to have consent to give this vaccination to residents, and you're going to need to know, or individuals you support, and you're going to need to know how many of them want to do that. So start thinking about how, and we're going to be working on that at the state level, and as we get that information together, we will share it to you, but start thinking about how that looks for your agencies. Okay, that's vaccination. I'm sure there's questions in the chat, but I'm going to keep going, and then I will go back and look in the chat because I can't do both right now at the same time. The next thing I wanted to talk about was the budget update. So we did get really, thank you, Heike, for reminding me. There is also this website out there. We know a big concern around the vaccination is information. And so the state has put up this website also with information for residents on if you need to get vaccinated, vaccinators, and how to get the facts. And so there's a lot of really good information on here. If you will scroll down, Heike, one of my favorite parts, and I have not had, I just saw this website yesterday. Go ahead, go down. Maybe you might have to go to get the facts. There is a really cool thing on this website called rumor control. Okay, go back up. That's all really technical, and I will talk about that here in a second too. So click the get the facts. And then if you will scroll down, or even just look at the top, there's safety, effectiveness, privacy, cost, availability, history, and rumor control. So there's a lot of information on this website, and I really like the rumor control section because these are real questions that the Department of Health and Senior Services is getting answered, so they're posting them out there with the answers. So residents, I like the question, residents will not be used as guinea pigs if they choose the vaccination. Residents aren't even in the first category for vaccination. So just wanted to make sure that everybody understood that this resource is out there too. We know that when you're starting to talk to your employees and individuals you support and guardians about the vaccination, they are going to want more information, and this is a great tool to help them get more information. I know we're also working on developing some one-pagers that we can hopefully ship out to everybody so that they understand more information about the vaccination. So I think that's all on Oh, the other thing I was going to tell you, and you will see this in the news today if you haven't already, Pfizer has put in their request for the approval of their emergency use authorization. So there are 2 steps that have to happen before that vaccine can go in the arm. And that is the emergency use authorization has to be approved. And then after that is approved, then there's a secondary committee called the Academy for Immunization. It's ACIP, and I'm not going to get what that means right. It's a federal committee. But then they also have to approve it before it can go out the door. Now, the vaccine is going to be pre-positioned across the country. So as soon as that last approval is received, you can do vaccines that day because there's going to be access to those for folks. So, but they believe that emergency use authorization could take between 2 and 4 weeks. Then once that is granted, there will be about another week for that second group to finish up their approval, if it's approved. And then, so you're looking at 3 to 5 weeks right now before a vaccine's probably available to go in the arm. So I just wanted to make sure people kind of understood the timeline of that also. Okay, that's all on vaccine, I think. Budget update is next. So we had that $20 million of CARES Act funding that was available for our residential providers, both ISL and group home, day hab, and employment providers. So we got through the first round of that, and we've got about $5.4 million of that was not spent. Providers did not request money, and I think it was about 138 providers that did not request any of their allocation. So now we have been given approval by the administration to reallocate that $5.4 million. So we know we had a lot of providers. So we have done that. We've done it based off the same allocation we did the first time. So that sets aside about $621,000 for our day hab and employment providers. And then the remainder of that $5.4 million, I cannot do math in my head quickly right now, will go to the be available in an allocation format for our group home ISL providers. We were not allowed to change how we do the allocation. We did ask. So I know there's going to be some frustration out there. We did ask, and that is what we were told at this time. With that, we are also going to open up the day hab and employment providers if they would rather invoice us for cost of PPE, overtime, the same kind of things that we know they are experiencing, that the residential providers are experiencing. They can choose the invoice option over the business interruption option. Either option's available to them. So I just wanted to make sure that everybody understood that too. We have a very quick turnaround. So we have to have information back from the providers by December 1st. And then we have to get all of our stuff done on our end, I think by December 5th for processing through this round. The good news is I think there's a lot that we can do with providers who submitted above their allocation already. And so our goal is to try to take care of that so that we don't need anything from providers. So I know that provider relations will be reaching out to providers if they need additional information, but be up in our business about this because we got to get it done by December 1st, and we want to get as much of this money back out the door again. Very grateful for the opportunity to reallocate the funding that we did not spend the first time around. Then the next item, please be paying attention to hospital status. We're hearing, and this is across the board, and it's not just for individuals with developmental disabilities, but hospitals are at capacity or near capacity at this point. And depending on the type of care you need, you may need to go to a different hospital than you're used to going to. Also, we are hearing that discharges are happening rapidly, and people are oftentimes uncomfortable with that because those are discharges that before they would have seen taken a little longer, but hospitals need the bed space. So we do have tools out there to help. And I understand being uncomfortable about supporting somebody with high medical needs because that's we have some folks that are very good at that, but sometimes those things come up quickly and we cannot get everybody trained the way we think we need to train them. But just you need to be paying attention to your local hospital status, and I just want to make sure you're keeping track of that. So I'm going to go look in the chat now, and I'm going to turn this over to Angie. I know that was a lot, and thank you for hanging with me. I don't usually talk for 30 whole minutes on this, so thank you so much.
Okay, good morning, everyone. I'll take over while Val's looking at questions. One thing that we've talked about in the past is that we have been asking CMS about extending the Appendix K waiver and then and then portions of our 1135 waiver. So far, we have not been allowed to do that, although they have been having internal discussions at the CMS level about the extensions. With the governor's declaration yesterday, we went ahead and posed that question to CMS again, and they responded to us actually while we were on this call here, that they are sensitive to the increasing numbers across all the states, and they are actively looking at steps as they approach the January 26th end date for many of their Appendix Ks, again, across the nation. And so they are going to follow up with us with some guidance as soon as they have that available. So just wanted everyone to know that we are in constant contact with CMS on trying to get that extension. Then the other thing is we have those two waiver amendments that we've submitted to CMS for the unduplicated participants and then for the service reduction. They are still reviewing those, and will get back to us with some questions hopefully in the next week or so. And then for the actual renewals for the comprehensive and community support waivers, those are under a Department of Social Services review still as we speak. And so as soon as they finish that process, then MilHealthNet will be able to post those for public comment. And that is all I have. I don't know if we have, Val, did you want to go back to questions or do you want me to turn it over to Wendy? We're going to turn it over to Val for questions.
Yeah, thank you. I was like, wait, I got to unmute, and, the screen went black because that's what happens. So there is only really one question here, and it's kind of a comment, kind of a statement, and it's about, so TCMs are not considered patient-facing healthcare workers. I get that you are doing activities that involve working with individuals. However, when we're talking patient-centered healthcare workers, we are talking about people that are helping with activities of daily living, okay? So if you're not toileting, if you're not bathing, if you're not doing those things right now, we can't move you up in the category. And it's all about volume of supplies available, okay? And I get it's frustrating, but I do, yes, we do require support coordinators to make face-to-face contact if there's health, safety, or well-being concern. And I understand that, and we need them to continue to do that. But there are community testing options out there. That it's just where we're at right now. It's a volume issue. It's what it is. Okay. And and thank you, Sarah, for posting that you had difficulty getting a person. We're hearing this all over the state. We're hearing this for our state-operated facilities also. So this is real for sure. Okay, moving on to, I believe Wendy is next.
Hi, thank you. Good morning, everybody. And I just wanted to be real brief to remind people that the options for them to modify the residential situations is still out there. It's covered under our Appendix K. I know it was real effective for folks to consolidate homes or ISLs, or staff moved in, or they went home with staff, or went home with family. So those are some options, but also wanting to let you know that if you have thought of other ideas that would really help you, but are currently kind of outside the bounds of what you think we can currently do, please contact your PR representative and let them know about your circumstances. If your agency is really stressed with staff ratios and having difficulty and are concerned that you might need to give notice on folks, perhaps if you're struggling with ratios, please contact your PR representative, and we are all putting our heads together to try to identify how we can help providers overcome some of these obstacles and come up with some different things that maybe we haven't tried yet. And if you already have those ideas and said, if I could only do this, it would help so much, please let your PR rep know. They in turn will let us know, and we will get together and figure out if there's a way that we can make it work, make it okay, if we need to do another Appendix K, whatever we need to do. But we are looking for those good ideas from you too, because they're going to more likely come from you than they're going to come from us. So just please don't hesitate to reach out to your regional office if you are an agency or a provider that is really under extreme stress and you're worried about what you're going to do, we want to try to help you. We know these are extraordinary times, and it's not a reflection on you or planning or your ability to operate your agency. These are just extraordinary times. So please reach out, let us help if we can. That's really all I wanted to kind of touch base with you guys on. So I will turn it over to Kim.
Thanks, Wendy. I really didn't have anything specific, just to piggyback onto what Val said real quickly earlier in regards to what we're seeing with hospitalization capacity right now. Just continue to please use your resources that you have available. Reminder Station MD services are still available. There's opportunities for telehealth, telemedicine. If you're in need of, brainstorming resources, et cetera, please reach out to your regional office QERNs. They can be a resource to everyone right now. And that's all I have.
All right. Thank you, Kim. There's a couple more questions in chat I'm going to address. One is, will there be an extension of Station MD? I don't know the answer to that at this time. What I know is that everybody wants us to be able to extend Station MD, so it's including Station MD. So we're looking at this 4 different ways at this point. I know we're going to have a call today with the National Association to try to figure out how we could maybe get Station MD covered as a Medicaid waiver service. And I know that's something that CMS would be very much interested in also. But that's a process you have to go through, and that takes days. And then we're also talking directly with Station MD folks, because I think they're willing to help us if we've got to wait 2 weeks or 3 weeks before we know the answer to something on the funding side. So I cannot tell you. All I can tell you is everybody, the administration, everybody likes the outcomes we're seeing from Station MD, especially right now. And it's going to be really difficult for anybody to even get into a doctor at this point. So, you're not, urgent care is probably not your first choice, or shouldn't be your first choice, especially in certain parts of the state, because of all the people that are there just to get tested for COVID. So please be using Station MD right now, because the more use we have of Station MD, the easier it is to sell the Station MD product. But we're really having good luck with selling it. It's just, you got to find the funding for it. And and we're trying to make it cheaper. We've got ROI on why it saves us money. People even are very supportive of just the anecdotal side of how much easier it is for providers, for families to use Station MD versus trying to go to a doctor. So it's very well received. The other question we have right now is, are job coaches included in the 1A class as they are providing in-person services also? I'm going to say no at this point. When we are talking patient-facing healthcare workers, we're really talking about those people that are helping with the and as a provider, you can make that decision to try to get your job coaches included in the category of 1A. But again, remember, we're looking at 167,000 doses coming to the state of Missouri on the first go-around, and we're looking at an estimate of 500,000 healthcare workers. And I can promise you they did not include job coaches in that when they were coming up with that 500,000 number. They're looking at people with job titles like, they're looking at, remember we kind of talked about this in the past, people with job titles like CNA, those kind of positions. So I want you to be aware of that. That doesn't mean if you feel like you should try, you need to try to get them in the 1A category. We're not going to, I don't make that determination. But I just based on the conversations we had yesterday, they're looking at those people that are actually just delivering that direct level of care on a daily basis. So I think, thank you guys. Thank you for sticking with us for an hour and 10 minutes today, or 40 minutes, today. I know we put a lot of information out there. I promise we will keep talking about this information so that you are more comfortable with it. Of course, you can send us questions, and stay safe. Good luck, and we'll keep pushing everything out that we can. Thank you guys for all you're doing. Have a good weekend. Goodbye.